The homeless crisis that we're experiencing in this community is a complex, multifaceted issue. It is a humanitarian crisis at its core. And it is not just a Portland issue, this is a nationwide issue. I was just a panelist at the United States Conference of Mayors in Washington, D.C. I was on the homeless panel with 3 or 4 other mayors from large cities, including Eric Garcetti from Los Angeles and others. And the room was about this big, and it was full of big city mayors from all around the United States. And I asked them, could all of you who see this as a growing crisis in your community raise your hands? And they all started laughing because each and every mayor in the room raised their hand. And then I asked, for those of you mayors, and these are Democrats, Republicans, giant city mayors like Houston and LA, and smaller cities. And then I asked, for those of you who are raising your hand, which is all of you, how many of you see this as the most important issue that you are working on right now? Every single one of those mayors raised their hands. This crisis is growing. And I see not only a moral obligation to address this crisis, I think there's a pragmatic case to be made that we need to figure out the solutions so we can help other cities around the country address this crisis as well. And by the way, it's not just in the United States, it is spreading globally in industrialized nations, and there are a lot of reasons for that. I want you to know that as your mayor, this is my #1 issue. I focus on this like a laser beam from early in the morning until late at night. This is the #1 issue that my administration is working on, full stop. When we talk about homelessness, we're talking about a whole bunch of different issues. We're talking about economic issues, we're talking about housing affordability issues, we're talking about disability issues, we're talking about substance abuse, we're talking about mental health issues, we're talking about breaks in jobs, breaks in health, for many women on our streets, they're escaping situations related to violence, domestic violence. For a lot of the youth on our streets, they have their own particular personal lived experience and stories. Some are coming out of the foster care system. Others have situations where they are running from issues of neglect and abuse. And so that's a long way of saying there is no one solution to the overall issue of homelessness. And when we look at the crisis and how we manage it, the city, the county, many of our service providers, we really break it into 3 buckets. First is what we'll spend most of our time talking about today, which is what I just call generically the collective suite of compassionate responses. That's how do we connect people to whatever help they need to get off and stay off the streets. But we also have to acknowledge, and I get a lot of calls on these subjects as well, that there's a livability component to this. And there is no question that some camps create public health, public safety, or environmental hazards, not just for the community at large, but for the people in those camps. And we have an obligation to act. And you're going to hear about that today. And people are very, very heated on this issue as well. It's an important issue. It's a controversial issue. And it's one we should frankly and openly and honestly discuss. And the third area is public safety. There's no question that there is concern for people who are living on the streets. We know that there's a lot of violence directed towards people who are living on the streets. And there's also a lot of concern about the public at large and some of the behavior that people are exhibiting that needs to be addressed in this community. And we could talk about some of the substance abuse issues maybe being front and center, some of the unaddressed and unserviced mental health needs in the community being another. So I want to just acknowledge this is a big subject. You can't cover it all in 3 hours. No way, no how. And I want to start off with good news, bad news. Believe it or not, and this panel, I was on it for a reason. Portland and Multnomah County are seen as leaders in finding the right solutions to address this problem. I want to be clear. I did not say because we have solved this problem. We have not. But like Commissioner Jayapal said, I believe we have the right formulas. I believe we know what works. And I believe we are making the right investments. The question is, how do we collaborate? How do we partner? How do we bring other people into the solution? And how do we bring this to scale so that we can actually make the progress that people want to see? The overall number of people who are homeless, and this is according to our HUD point-in-time count. This is something we're required to do every year. We are very thorough about it. We take it seriously. It's done all over the country. And every year, we send people out into the community, and they do what's called the HUD point-in-time count. And they look at the people who are on the street, they look at the people who are in shelters, they look at people who are in cars, and they do a count. And nobody believes this count is 100% accurate, so don't get me wrong, but it at least gives us a baseline idea of what the trends are. There's good news, bad news in the trend. The good news is the overall homeless population has remained relatively stable over time. Since between 2017 and 2019, the overall count actually went down about 3%. Between 2013 and 2019, it actually went down about 10%. That's the good news. So why isn't anybody celebrating? And the answer is because you can walk out the front door of your house, or you can walk out your business, or if you are living on the streets, you can look around you at your circumstances and the circumstances of the people around you, and you can see that the problem that is visible is getting much worse. That's true. The unsheltered population in our community continues to grow, and it continues to grow at an alarming rate. The chronically homeless population, so these are individuals who self-identify as being on the streets the longest, and they have coexisting conditions. It's not just about housing, but it's also about coexisting conditions. Maybe they have a substance abuse disorder. Maybe they have a mental health issue that they're living with. Maybe they have other disabilities that they're living with. That population increased by 37% over a 2-year period. And that accounts for nearly the entire increase in the unsheltered population in our community. So the people that you are seeing on the street, in other words, they're there longer, and their circumstances are more dire, and they're less healthy, meaning they need more interventive services, and they need to be connected to services in order to be successful in their housing. I have been, along with my colleagues, a strong proponent of revamping the system, of evolving it, of changing it as our understanding of the problem evolves. I've been data-driven in my approach, as is the Joint Office. We don't just try stuff for the heck of trying stuff. We try stuff that we know has a likelihood of working, and then we measure the success to make sure that our limited resources are actually going into programming and ideas that show good results. And you probably are now aware that there are also quite a few people in this room today who are themselves houseless at this very moment. And I'm glad that you are here if you are houseless. I will not ask you to identify yourself, but I'm glad you're here because we also need to learn from lived experience and talk to people who either are homeless or who previously were homeless and ask them what worked, what made the difference for you? Or alternatively, what would make the difference for you? What's the difference between being on the streets and being in housing or being connected to an employment opportunity or other services you need? Help guide us through your lived experience. And we take that very successfully. And I also want to acknowledge that we have changed the way we think about it. When I took office back in whenever it was, 3 years ago, I guess, the name of the game even then was get people out of the elements. Open as many shelter spaces as you can and get people in out of the elements and into the shelter. And that was pretty much the response. What we've learned, particularly now that we know that more people are chronically homeless and they have other coexisting conditions, is that's no longer sufficient. We still have basic shelters, but what we do now is we think about how to connect people intentionally to other services. And that's why the county and the city have to work together. They provide a lot of the public health services. We provide a lot of the infrastructure and housing. And what we've done to address this increase in the chronically homeless population is we have strengthened that shelter system to include what are called navigation centers. So instead of just a place to come in out of the rain, it's now a place where you come in out of the rain and you're connected to services. You're connected to whatever services you need to be successful. And we now have one on Foster. We have a new one that opened in the Pearl District. And we also acknowledge that a lot of people aren't going to come to a shelter, particularly if they've been on the streets for a while. So we have created navigation teams which go out into the community to where people are and build that trust, build that relationship, and with time connect individuals to the services they need. And that is showing very, very good promise, even though it's a relatively new program. I also want to acknowledge, just because this is sponsored by the city and the county, we are not the only people in this game. There are dozens of nonprofit service providers who work with the homeless population in our community, and there's many leaders in this room today, and you're going to hear from some of them who work alongside of us. And collectively, we are making results. Last year alone, something like 7,000 people who were on the cusp of homelessness, who are identified as having a high likelihood of becoming homeless, received preventative services. About 7,000 people who could have been homeless who are not because of those services. Last year, collectively, we moved about 6,000 people off the streets or out of our shelter system into housing. And speaking of housing, since housing is central to all of this, over the last 2 years, the Portland Housing Bureau, and Shannon Callahan standing in the back, she's the director, she'll be speaking later, have had their 2 record years of affordable and very low-income housing production. And you all had a role in that. You all voted for the Portland Housing Bond back in 2016. There were some very specific objectives that needed to be achieved in order for that bond to be considered successful. And I can tell you that we have exceeded all of the metrics on that housing bond years ahead of schedule. So that's a good start. It's not sufficient in and of itself, but just in the last couple of years, we have opened 2,400 new units of housing. 350 of those are very low income housing units, which would be appropriate for people who are coming in off the streets. We have about 4,700 people living in those new units on a day-to-day basis, and we have about 3,100 units currently in production. So we are significantly increasing the housing units. And while we have 4,000 people counted as being homeless in our community, on any given night we have about 12,000 people who are in housing because of our collective and our focused efforts. 12,000 people. And as the sign somewhere around here, here it is today. Last year, about 37,000 people received services either through the City of Portland, the City of Gresham, Multnomah County, through our Joint Office of Homeless Services. So we are making that difference. And finally, I just want to say this, and this is where you really are important. We want innovations. We want new ideas. We think like entrepreneurs because we are trying to figure out new strategies as our thinking evolves. And we have invested in new interventions over the last couple of years. The Kenton Women's Village, it's a tiny home village. That's an idea that came to us from the community. And then we worked with the community to execute on that idea. The hygiene pilot. You know, a lot of people who are homeless and living on the street say, God, there's just like nowhere to go to the bathroom. Businesses won't let us in, hotels won't let us in, places that many of you and I take for granted. If we need to go and we just go and we use the bathroom at a local business, a lot of people who are homeless do not have access to that opportunity. And on the other hand, we have business owners and operators saying, what the heck? I mean, people are relieving themselves all over the place. The obvious solution is hygiene pilot. And so we put $1 million into our last city budget, and we now have the hygiene pilot. And the beauty of it is not only does it provide a compassionate place for people to go, it also provides an entry-level employment opportunity for people who are currently on the streets. And then, of course, our storage facility, so people don't feel like they have to take their stuff with them. We also have compassionate response around livability and public safety. You're going to hear a little bit from our urban camping intervention. And I want you to listen when they're talking because there's a lot of misunderstanding about what we do in terms of remediating the most problematic camps, which are truly identified as being either environmental public health or public safety threats. And we do that in a thoughtful, compassionate, data-driven way. And you're going to hear about that. And last but not least, if we have time, you're going to hear about public safety and some of the interventions that we have created around compassionate and effective responses to homelessness, like the behavioral health unit that works with people who are living with mental health issues, or the service coordination team that works with individuals who are houseless and struggle with addiction. We get them into housing and we get them into addiction treatment programs. And then some of the other work that we've done, like hiring a homeless liaison in the police bureau to work with us as we help address this crisis. And finally, the street response. That's a partnership that I'm working with Commissioner Hardesty on, so that we don't always have to send police officers into the community when somebody is having a mental health or another kind of crisis on our streets. We can send in trained, properly resourced service providers to do that work, with the police taking a very backseat role. Let's see if we can solve it on a social services front first before we utilize our police resources. So those are just some of the things we're working on. I look forward to hearing more ideas. I thank you for sharing my passion on this issue, and I thank the many of you who I know in this room who've been working on this issue for many, many years. I look forward to the discussions today and into the future as well. Thank you for being here.